on this episode of A Tale of Two Hygienists.
There is a dental code for this, and so usually when I say it's only medical insurance, people will start commenting, there's a new dental code, there's old dental codes. If I'm being honest, none of them are great. Even the new one, just because there's a code doesn't mean that anybody's reimbursing it yet. It can be really helpful to explain to the patient just a few things on this sleep study that are going on in their body, because it helps them to know why it's so important to get treated. People who have heart attacks, for example, you can't feel that you're about to have a heart attack. But if you look at a sleep study and it shows that your heart rate is through the roof at 2 o'clock in the morning when you should be fast asleep, that can help to indicate, hey, your heart's really working overtime. Like, it's really important that you get treated now.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 446. My name is Andrew.
I'm Annie.
What's up, Annie?
Hi, Andrew. So happy to be here today.
Yeah, me too.
Good. Listeners, we have a great episode for you today. We have part 2 of our discussion with Teresa Power DeNike, and she is chatting with us today about sleep hacks, lip taping, different sleep solutions to that patients may ask you about. And so it's a really great episode. She has a lot of insightful tips that we can chat about with our patients.
Yeah, I feel like the first episode was really about here's the problems, right?
Yep.
And then here are the things that people do to try and do everything they can to avoid actually going to get the studies done. Yes. And the do-it-yourself stuff. It's a really good episode. Teresa's really smart.
Yes, she is.
And then everyone, next week we have a really interesting episode. It's different than probably some of the other episodes that we've ever done. And Annie, I know, so we recorded this at RDH Under One Roof, and I know you couldn't be there. We'll talk about that in a few minutes. Yep. Of what's going on in your life that caused you to abandon us all under one roof. Yes. But we have this really amazing episode about sustainability in dentistry. And it's the thing I like about it is sometimes when we talk about sustainability, it can kind of get kind of woo-woo-y, right? But we have Brittany Cox on. Brittany, she's, first of all, an avid listener. So shout out, Brittany. Thank you for listening for all these times. But she brings a very practical approach. So if you are not looking to go, super green in your office, but you just want to take that one step towards doing better for our planet, she has some really good insights and some tips for that. So it was really good. I wish you would have been there, though, buddy.
I know.
We missed you a lot.
I know. I'm really sad that I missed Under One Roof. I was trolling social media and feeling it was bad. I was like, okay, I need to stop doing this. But for those that are listening, I had to step back from Under One Roof this year because I just had a baby. And so it's been a whirlwind. I can't believe that she's here and I have a child. So it's so I look at her and I'm like, how is this real life? Please pinch me. So anyway,
this is, first of all, congratulations to you guys for this. This is really great. I can't believe you're actually doing this intro right now. This is just blowing my mind. I'm like, dude, do you need a few more, do you want to get acclimated to crying babies and stuff like that? And you're like, no, I got this. And you're upbeat and peppy. And I was like, I don't know if this is just adrenaline running.
Probably. It's going to hit me really bad next week or something. I don't know. It's probably some adrenaline, but thankfully she's a perfect baby. So it's great.
Oh, I love it.
Yeah.
Allison and I, we love babies. Baby stage is my favorite stage.
Yes.
So hopefully I get to see her at some point.
Yes, absolutely.
It's really interesting though, because I met you were not pregnant,
I
and
know.
all of a sudden you've had a whole pregnancy, and a child's here now, and this is just,
I know.
It's just so bizarre.
It is.
So,
I know how the time goes. It's crazy.
Yeah. So okay, so I don't have a good segue for this next thing, but I want to tell you about this podcast I've been listening to.
Okay.
So I've been listening to this podcast called Acquired. Acquired is basically, I think I've mentioned it on the show before, probably actually multiple times. I'm actually a big fan of it. Basically, it's okay, you have Apple, you have Microsoft, you have, Warren Buffett was on there with Charlie Munger was his business partner before he passed. And they did kind of like some deep dives into these people and how they, became, what they are and how important they are. So they tell a little bit about the history, and then they do some like financial analysis, and then they talk about like some of the lessons that they learned. I mean, it's just really, really good, really well done.
It kind of reminds me of like How I Built This or something.
Okay, so it's kind of like How I Built This, but like it's a 3-hour long or 4-hour long.
Oh my gosh, that's
one.
so long.
And it's more of the analysis rather than just the story. So How I Built This with Guy Raz is really, really great
yes,
show.
It is. Yes,
he is a storyteller. He helps the owner, the whoever it was, the founder, tell the narrative of this, and he walks us through like kind of linear timeline. This is how it all happened.
Okay.
But then they take it to the next level, and so I was going through the back episodes, the ones I haven't listened to in a while. There's Nike, the NFL's on there, some really good ones.
Yes.
But I got kind of bored with some of them. I'm like, I was kind of surprised. And then I saw Taylor Swift.
Oh, okay.
I remember one time Sarah Thiel's, one of our friends for the show.
Yes.
She, I remember one time I was driving. I think I was in Kansas City, and she said, and I had the radio on, and Taylor Swift her new song came out, and she's like, "Oh, turn it up." And I'm like, "You're on the phone. I'm not listening to this stuff. Like, I'm not gonna do that."
Right.
And like everyone I know is a big Taylor Swift fan, and with I'm an NFL fan, so there's this whole narrative going on this last couple of years with that.
Yes.
So I have made a commitment after listening to almost 2 hours of the Taylor Swift saga.
Yes.
I'm going to listen to every single one of her songs in order.
Oh my gosh, love that.
That's crazy.
Great.
From 2006.
I mean, that is. Yeah,
She was a country music star. I'm sure
she was.
Everyone that listens knows this.
Yes,
I'm finding out all these new things about her. I'm like, oh.
But I love that. I mean, I was like, again, going back to I think our last conversation or something, how much I love documentaries, but it's more so like finding the backstory, and so that's quite the feat. And it reminds me of, this is kind of a little bit of a tangent, but I love watching Survivor, and last season on Survivor, one of the contestants, he was like a Taylor Swift super fan, and he could like list and name like every Taylor Swift song. Like, it was crazy. So anyway, that's what made me think of it, as you're going to go through in order.
I'll never get that level of fandom, and I won't be able to recall any of the names of any of the songs or anything like that. But
yeah.
I mean, because they were like listing off these ones, I'm like, oh, that kind of sounds like it might be something I should know.
Right.
But the funny thing is, it's one of the, even though I couldn't name a song or like what album it's from, I couldn't name any of the albums, but I could tell you like, oh, this is familiar. I know this song. I've heard it somewhere before. Like, it's so everywhere in our society.
It is everywhere. So. Yeah, definitely. I know. I feel like that too. I mean, I'm not like a crazy Taylor Swift fan, but yeah, I could definitely like recognize or identify like some songs. So.
Well, look, if I end up being a Swiftie after this, I'm going to be very, very surprised. But, we don't know.
Hey, you never know.
All right. I think that's pretty much it for the intro, everyone. We appreciate you listening so much. You're going to really, really enjoy this episode with Teresa. And then don't forget, make sure you're hitting that follow button on Apple Podcasts or the subscribe button on whatever podcast app that you're a part of. But thanks for being with us. We'll talk to you next week.
A tale of two hygienists.
Listeners, welcome back to the interview portion of the podcast. I am Annie, and I'm here today, and I'm joined by Teresa. Teresa, thanks so much for being here.
Thanks for having me back.
So we are following up on our last discussion with Teresa. We're talking about sleep, and today we're talking about integrating sleep into the dental practice, sleep coordinators, and so let's get into it. So Teresa, following up again from our last discussion, we talked a lot about, we kind of laid a good foundation with sleep. What next? How can we start integrating this in our practice if we're ready and wanting to do that? Or what are some small steps we can start taking now?
What next? Such a good question. Because again, I feel like I see so many people, they go to these sleep courses and they love it. They're excited. They cannot wait to do it. And then they get back and they're like, oh my God, where do we start? Like, my team is going to kill me. I'm going to add something else to the practice. My hygienist is going to quit. But it's so satisfying. And yeah, once you get into it, you can't unlearn it. You can't unsee it. So I think the first thing is kind of what you started to say already, is like, you kind of have to decide how much sleep you want to do. Do you want to just screen your own patients and treat them? I think that's a great place to start. I think there's so many patients, you might as well. Do you want to become a sleep dentist, airway focused hygienist? You have to really decide, because that's gonna determine how much you integrate this into your practice. at the very bare minimum, as you mentioned in the last episode, you want to start with screening your patients. And so if you're doing this screening and if you're asking these questions, then what? Like, what are you going to explain to your patients? And that's where I think it's really important to have a sleep champion, if you will. I mean, again, if you're going to be like a dentist, a sleep dentist, I think you should hire someone very specifically just for sleep. We'll call them your sleep coordinator. They can do everything from screening to helping to plan the logistics for testing and treatment and walking through everything and follow up. But at the very bare minimum, you have to have somebody who at least can do some patient education and talk to the patient about that screening. So whatever you want to call them in that case.
Yeah. Having a designated person to help facilitate that would be helpful. When we're having these conversations with patients and if we start screening, are there like resources that we can use, or like are there like screening forms, or like where can we go to get that information?
There's a ton of stuff online. I do a quick plug here. I do have some resources online that can be customized for dental practices. This is going to help kind of walk through some of the basics and the education and what to expect, both to reinforce what that, we'll just call it our sleep coordinator, is saying to the patient, and also, something for that patient to bring home. At the very bare minimum, there's only a few clinically validated questionnaires. So you can find those online or at the AADSM, American Academy of Dental Sleep Medicine. So you can find a lot of that stuff online as well to just get you started at least.
Okay.
Can we talk about the logistics real quick of a sleep coordinator? Because I feel like, I'm picturing the office, we do have like treatment plan coordinators. So we have certain people that are kind of carved out to take a few minutes with the patient, talk about a certain something, and then they go about their day or whatever. So the logistics of it, like if you're screening all of your patients, you have 20 patients that are entering your practice through a day, what kind of time commitment is this person's like expected to have? And then also, are you, in all the conversations with all the doctors and stuff that you talk with, is it a profitable position to have? Because I think that there is definitely that part of it where, if someone wants to be a, sleep coordinator or whatever, it's like, well, what am I also going to get out of it? And is doctor going to pay me more or not pay me more to be able to do this? Can you talk about those logistics a bit?
Yeah. If you're saying, let's just talk about people who are only screening people in their practice, maybe they're not like seeking referrals. Yeah, I think that makes the most sense. If you're doing that, an extra few minutes, let's call it, 5 minutes in your screening. So maybe it's a hygienist on your team that just has taken an interest in sleep. Maybe they've done, a few courses or online CE. They know the basics. That's all they need to know. They need to know why you're asking the questions and the common questions that the patients are going to ask as well. So that's going to be an extra 5 minutes of your day. If you are a sleep dental practice, I have yet to see any that are completely successful without somebody who's totally focused on this. So that could be a part-time to full-time job just doing that, because again, it requires follow-up. But if you are a hygienist and you're doing other stuff in the practice, I personally think it's a really great way to help to introduce some more revenue into the practice. And if you have, incentives or anything like that in your practice now, productivity, things like that, this can add to that. It's something that's very interesting. People are going to like you. You're going to help, their sleep and their lives, and, maybe prevent them from having a heart attack, for example. But it also can be lucrative for the practice. And so it's a little time, yes. You have to manage that because, you can't bill for all of the time that you spend with patient education. But if that patient does follow through with treatment, that's an additional revenue source of your practice that you never had before.
Can we touch a little bit on, because when you're talking about billing and a revenue source for your practice, can we talk a little bit about medical insurance billing? Because I feel like that might come up a little bit when we talk about billing out for sleep studies or appliances.
Yes, and that is by far one of the biggest hurdles in dental sleep medicine.
Yeah, I bet.
So, as I'm sure you can assume, this can be a whole conversation.
Yeah, absolutely.
I'm not a billing expert, but I've worked with hundreds of clinicians, so I can talk a little bit about it. In that, this is a medical condition. It's treated by a dental professional. It's treated with a medical device. It's covered by medical insurance.
Mm-hmm.
most people these days, if they have medical insurance, they want to use it. And so they're going to ask about it. But people also have very high deductibles. So it's all sort of ironic. There is a dental code for this. And so usually when I say it's only medical insurance, people will start commenting, there's a new dental code. There's old dental codes. If I'm being honest, none of them are great. Even the new one, just because there's a code doesn't mean that anybody's reimbursing it yet. I would kind of just hold off on that. If I were in, that position, I would just hold off on using that and only use medical billing codes if you feel comfortable doing that. And there's also the whole point is that this is an added service. So potentially you even just want to do fee for service. Maybe you want to make it a little bit easier. Patients, they don't really know the difference anyway, whether you're accepting medical insurance or not. And if I'm just making up a number, but let's say your fee is $2,000, it would be great for medical insurance to cover that. Almost all medical insurances do cover oral appliance therapy, but if you're not willing to learn it and put in the paperwork or hire a third party, you can do fee for service and, give them a payment plan. If they are worried about that and they go down the street to another dentist, they're going to have the same answer. So it's not like, you're not overcharging for anything here.
And there are plenty of people, that third-party people, that could either you outsource and have them just be that part of the practice for you, or they could also you could take their course and you could learn all of these things.
Yeah,
so
there's really only one billing code. So in theory, it's just like everything else with dental sleep medicine. It's not hard. It's just tedious. It's a lot of documentation. It's not difficult though.
So, okay, so let's walk through the process a little bit more. So we have our coordinators. These people have talked with the patient. The patient is now accepting the fact that we have noticed something. So what is the next step? Is the next step now sleep studies need to be conducted?
Yes, 100%. The next step is sleep testing. Now, if you're not going through insurance, you could technically avoid this. I don't think that's ethical, but we want to see if they actually have sleep disorder breathing, obstructive sleep apnea, and most often they do because these screeners are very predictive. So we need to get them a sleep study. Now, at this point, a lot of patients are going to be hesitant because they've only ever seen, the sleep studies on TV where they're plugged up to a million different things and they're sleeping in a lab and they're being watched. That's called polysomnography, which it does still exist. It is still very important. If a patient has cardiac conditions, pulmonary disease like COPD, signs of other sleep disorders like restless leg syndrome, or if they're a pediatric patient, they will need to go to get an in-lab study or PSG or polysomnography. So that is something they'll need to do. But if not, most people nowadays and most people's insurance nowadays will cover a home sleep test, which are a lot easier. They're super small. And if you're in a dental practice, most likely you will be working with a third party that basically handles all of this because this is a medical test and it's not something you can bill for anyway. That's why I always recommend working with a service. There's really no point in spending time in your practice to do this because you can't bill for it. So use a third party, get them sleep tested, have it shipped to their home, have their doctor read it, and then you get that patient after they've been diagnosed.
And the diagnosis comes from the third party, correct? Or from the other provider that's reviewing it, and then they send the results and the dentist looks over it and discusses it with the patient, correct?
Yes, 100%.
Okay. And then,
if you want to work with a local physician, if you happen to be in a building with a sleep doctor, they can read it. That's a really great way to improve that relationship.
Sure.
But whoever does the sleep test, hopefully they have physicians on their staff that will interpret and then give you that diagnosis and prescription.
Okay. So then when the patient receives the diagnosis and prescription, what does that look like? Or what are the things they're looking at? And I guess then we can kind of go back into appliances, but what are the things that they're looking at?
The primary thing they're looking at is the apnea-hypopnea index, or their AHI. This number is thrown around all the time in OSA. It's not really as telling as far as the symptoms as we'd like. People are always trying to get rid of the AHI, if we're being honest, but it's an objective measure and it's the number one thing that we're looking at. So the AHI will tell you how often you stopped breathing for more than 10 seconds every hour. So if somebody has an AHI of 10, which is actually pretty low, relatively speaking, that means they stop breathing 10 times an hour, every single hour, the entire time they sleep. So that's number one. That's what we're going to look at here. We're going to look at oxygen desaturation, which happens when you stop breathing. We're going to look at heart rate, sleep cycles and duration, and how long it takes someone to go to sleep. All that stuff is really going to be looked at more by the physician than the dentist. But I do think, especially if you have a sleep champion, sleep coordinator, it can be really helpful to explain to the patient just a few things on this sleep study that are going on in their body, because it helps them to know why it's so important to get treated. People who have heart attacks, for example, you can't feel that you're about to have a heart attack. But if you look at a sleep study and it shows that your heart rate is through the roof at 2 o'clock in the morning when you should be fast asleep, that can help to indicate, hey, your heart's really working overtime. Like, it's really important that you get treated now.
Is there a way, this is so dumb, but is there a way to beat the test? Like, you know what I mean? Like, here's what I'm thinking. I'm like grumpy Gus old man, or like macho, these are both guys weirdly, but like the macho guy's like, I don't have a problem, but I'm being told to do this test anyways. I'm going to go ahead and like nasal strip and like tape my mouth shut and do all the things. So like I'm forcing myself to be good or whatever.
I mean, you could certainly improve the results. You can't beat it. Yeah, no, you can't beat it. If you have sleep apnea, you have sleep apnea. Now, if you're going to do that, though, if you are using nasal strips and mouth tape and like propping yourself on a pillow, then you're also, you're helping yourself with your apneic events. So like, you have a problem. But it's also,
Not how men think, though. They're like,
I
won. I beat it. I don't have a problem.
Sure,
See, the test says I don't have a problem.
No, there are so many physiological parameters that it's measuring. Some include brain waves. So like, that's kind of hard to fake.
Okay. Just wondering.
He's like, for a friend, not for me.
Yeah,
just for me, for a friend.
I've heard that this is a thing. Okay.
Then you had brought this up, but as far as like, patients get their results back, and what are their options? I mean, you did talk about appliances, but you just touched on lip taping a little bit and like different sleep positions. Can we talk about that a little bit more? Because I feel like I just saw an article recently, and it was saying that dental professionals shouldn't be recommending lip taping, and so that there's not enough research behind it to support it. I've been a huge proponent of lip taping. I've done it myself for a long time, and I know it promotes nasal breathing, which you talked about in the first episode, but you talk about those options too for patients and when they get their results back.
Yes, there are so many options, and this is a huge reason that I do what I do, is just knowing options alone makes people feel like they have a choice and makes them more empowered to make decisions about their health and to actually like follow through with it. If you have something wrong with you and they say this is the only one thing you can do, I mean, personally, I'm like, don't tell me what to do. But some people, they want an option. So There's lots of options. CPAP is the most common one. It's a mask and a hose. It pushes air into your airway, so you have enough air. It splints your airway open. It's very, very, very effective. It's also very annoying. So people don't love CPAP. Oral appliance, of course, is what we love to see dentists doing. It goes in your mouth. You wear it only overnight. It holds your jaw forward just a little tiny bit just to help keep that airway physically open as well. In none of these treatment options does it involve like oxygen or anything like that. It's just helping to keep your airway open. There are also, I would say, I don't know if they would be considered lifestyle, but I'll say they're more like lifestyle-y things like nasal strips to open your nasal airway, mouth tape to help with that. If you have already been diagnosed and you're being treated, mouth tape is safe for that. There's surgery. If you have ever even like watched an NFL game, you see like the Inspire commercials all the time for Inspire surgery, which is actually a really invasive surgery, but it can be helpful. But there's no topic that I get asked more about than mouth taping. Like from every health and wellness interview podcast, I even had like a full 30-minute interview with the American Academy of Sleep Medicine on mouth taping because everybody's curious about it.
One of my favorite photos on the internet, not to interrupt you, but there's a photo of this dentist that ran, I can't remember if it was the Boston or the New York Marathon, but he ran the entire thing with his lips taped.
Oh, wow.
Just to promote nasal breathing. So anyway, I just had to put that in there because I was so fascinated by that, and I thought that was awesome.
That is so cool. Also, like, makes me feel suffocated thinking about it. But if you have that link, send it to me.
Yes. Yeah, I will.
So I mouth tape from time to time. So I do mouth tape. I think, well, actually, let me start with the bad before I say the good. So as a clinician and being surrounded by clinicians, the bad thing about mouth tape is that typically people turn to mouth tape when they're snoring. And we know that the vast majority of people who snore have sleep apnea. Now, of course, not everybody does, but the number is somewhere up like 90%. You have some kind of sleep apnea. And so if that's why you're using mouth tape, I am going to go ahead and just say no. Go see a doctor. Please get a sleep test, get treated for sleep apnea. That being said, there is some research behind it. There is some research that in healthy adults, you see a lot of times with, these quote unquote biohackers, they're all using mouth tape. If they are healthy adults, if you can breathe through your nose, I love the idea. There is some little tiny bit of research to say that it promotes more deep sleep, which is great. It's rejuvenating. There is a tiny bit of research to say that you can use mouth tape with CPAP to help as well. We do see that's mostly anecdotal, but again, I don't need a study to tell me that like drinking water is good for me. Like I'm still going to do it. If it's helping you, I love that. I use it like when I like feel like I'm having a dry mouth a lot. I know that I've been sleeping with my mouth open. Sometimes if I drink alcohol, I tend to breathe through my mouth. So I'll mouth tape if I'm drinking. I think the huge like distinguishing factor for me is really just like, do you have a sleep disorder or are you just trying to like improve your sleep a little bit?
Such a great point.
That's interesting too, because I think the argument that we always make with flossing is similar, right? There's no real studies for flossing, right? But we just promote the crap out of it all the time because it's obvious. It's like, no duh, like this is going to be beneficial to you. But then there's also the caveats with the flossing, right? It's like, well, if you don't have huge embrasure space, like openings and stuff like that, then it's going to be great for you. If you have tight contacts, it's great for you. But in the other cases, then it's interproximal brushes that are going to be better for you, et cetera, et cetera. So again, underlying condition, if there's really a problem, but one thing I have, I mouth tape on the occasion as well, and I like it because it does kind of create that seal for me. No one can see me what I'm doing on the camera, but I do a vertical one like this.
Yes. Same. Mm-hmm.
And it's not like I don't completely seal, but it just helps because like I do like a gaped jaw, I guess, when I sleep. I just like
Same here.
My mouth falls open, and it's
Me
not
too.
like I don't feel like I need it to like help me breathe. I just need this thing to help me keep my mouth shut.
Yes, to breathe through your nose. Yeah.
Right. At the very bare minimum, it like prevents you from having like a dry mouth and like drooling on your pillows.
Which, by the way,
don't need,
gives
like,
you
a whole
whiter
strip.
teeth. I don't know if you notice that because your teeth don't get dehydrated then because your mouth's open, so your teeth are nice and pearly white. Anyways,
yes.
If anyone needs a reason to do it, just do that.
Yeah, like you'll see some of the mouth tapes. Well, I won't name brands, but like you'll see some that just look like duct tape over your mouth, or they cover your whole mouth, and like some people get scared of it.
Why won't you name brands? Just a curiosity.
I don't know, because I think some of them have irresponsible marketing. I would say, like
yes, I know what you're talking about.
Like first of all, that feels uncomfortable. I don't want duct tape over my mouth, but also again, like I don't want to use a mouth tape that says that like you can use this to treat your sleep apnea or instead of your CPAP.
Yeah.
Like maybe with, but yeah, like you just said, use like a vertical one. I have a few different kinds. Sometimes I'll even just cut them to make like a tiny dot just to like help like encourage my lips to stay together. Like you don't need it to be like super tightly sealed. Just a little encouragement can help you nasal breathe better.
How do you feel about, because we're talking a lot about nasal breathing, and in order to nasal breathe, obviously your tongue has to be in the correct position. Your tongue can't be low, and that encourages mouth breathing. But I more so want to know how you feel about patients that are using CPAP. Great, obviously, forcing air down their throat. They're breathing well. That's what we want at night. But then take that same patient, and if they have poor like oral posture during the day, like if they're mouth breathing during the day.
I think you see that a lot. And people who mouth breathe, they'll get prescribed like a full face mask because that's the way they're most comfortable breathing.
Okay.
And it's always, I can't prescribe CPAP. I can't prescribe what face mask you use. So
right.
That's the most comfortable, but I do personally believe that they should work on their nasal breathing. So, I think the most important thing is that they're treated. And so if they are going to work on nasal breathing and maybe myofunctional therapy or other exercises, I think that's really great, but they should first be treated. And so it's kind of like, and yeah, it's complicated. We see a lot of people who mouth breathe and they'll just get slapped on a full face mask and it works. And so it's treating them all night, and that's great and that's perfect. but they are still technically a mouth breather, and we want to, slowly improve that.
Yeah, that's what I was curious, your thoughts on that. So thanks for sharing that. So you touched on a little bit as far as we were talking about nighttime CPAP during the day, how to address some of these other underlying conditions such as mouth breathing and why one is a mouth breather and why one is not. Can you speak into myofunctional therapy a little bit and how that can help different things that we've developed over time?
Yeah, I love myofunctional therapy. I am not trained in it, but I do definitely follow like the basic principles of nasal breathing and tongue posture. These are all things that you do during the day, but it's training your muscles. It can strengthen your muscles, including your airway muscles, which are important when you're sleeping, especially again when they go paralyzed and you don't have control over them. So I think that myofunctional therapy can be helpful for everybody. We know that, and I think that you pointed out this study to me before, that it can reduce AHI dramatically, especially in children. It can potentially prevent them from developing obstructive sleep apnea, or at least reduce the severity of what they'll have when they're older, because we're helping to make a healthy airway. In adults, again, I'm not certified in this, but I would say that I think it's a really great complement to any other treatment. So I feel like myofunctional therapy can be incredibly beneficial. I also think that it might take some time. So in the meantime, I'd like them to be on an oral appliance. And then, so they wear the oral appliance during sleep, and maybe during the day, they're doing exercises and they're learning how to breathe properly and they're strengthening their airway muscles. I think it's a really, really great way to just make sure you have the best sleep and the best benefit, and things will happen a little bit faster too that way.
How often would you say, so if they're working on these exercises and maybe they have other things like, no, it doesn't matter, they have some other things that they're doing, how often do they then need to go back and get tested and have things adjusted? So whether that means that they're doing the full face and now the full face doesn't fit properly, or doesn't work, or it's not as effective, or they don't need that much, or they need to have their oral appliance adjusted, like how often, like every few months, or what does that look like?
Generally speaking, we'd say once a year. But if you are taking a lot of different measures, if you are a great patient, you really want to sleep better, you really want to improve your life, you're doing all these things, you will probably start to feel the difference. And so, sleep is so subjective. Yeah, we want to get those objective tests. But if you're doing all these things and you don't feel any different in like a month, then it's not enough. Then you need to get adjusted. If you're doing all these things and you start to feel amazing, or you start to feel like you can breathe better during the day, you're having more restful sleep, and maybe now you want to change your CPAP mask, for example, then after a few months, you can ask your doctor to prescribe you a different mask. Or you can go back to your dentist and say, you know what, I need an efficacy test because, well, actually, no, what would you say? I feel so great. Just make sure that a lot has to do with comfort. So I would say it really has to do with your comfort, and then otherwise once a year.
Okay. Well, Teresa, this conversation has been amazing, but two things I want you to touch on as we round it out. One, where can listeners find you if they want to get more information? But before you say that, can you talk about organizations such as the International Academy of Sleep and how they can really play a role in integrating this into our practice?
Yes. Real quick, there are a handful of really great courses and associations. Personally, I really believe in the International Academy of Sleep, the IAOS. They go over a lot of the clinical stuff in dental sleep medicine, but they also really focus on the business aspects. And I find that is the hardest thing. As clinicians, it's really easy for us to learn new clinical things, but then to integrate it into the practice, like we were talking about, that requires a little bit more help. And I feel like the IAOS does a really good job also with teaching you how to get a sleep coordinator and train them and really help them to focus on just sleep in your dental sleep practice to help make it more successful.
Great. Okay. And then where can our listeners find you if they want to reach out and get more information?
You can find me online, my website, sleepbetter.nyc, or find me on Instagram at sleepbetternyc, no dots or spaces. I have a ton of free tips and tricks there.
Great. And we'll be sure to put all of this in the show notes. Teresa, thanks again.
Thank you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental dental knowledge, and we do it all with ease. We cover oral health and screening and preventing gum disease. We're gonna do a lot of learning and have a little bit of fun working at the dentist. A tale of two hygienists.